is the largest solid organ of the body, and it is located in the right upper side of the abdomen. It is about the size of a football. In this picture, you can see the liver is present in the right upper side of the abdomen. The liver functions multiple. The liver does multiple vital functions. It detoxifies the blood. It clears drugs. It produces factors for blood clot formation. It produces albumin to hold the water inside blood vessels. It produces bile for digestion of the fatty foods. So these are just a few of the functions. The liver does more than 100 types of functions, which are not, which can't be listed here. But it is a vital organ. We cannot survive without liver. நாம் உயிர் வாழ்வதற்கு கல்லீரல் மிக அவசியம். The liver structure consists of sheets of cells called hepatocytes. These are the basic liver cells. These are just like the worker bees in a honeybee. So they do all the work in a microscopic level, which contributes to the liver functioning as an organ for the whole of our body. And then the liver also consists of blood vessels, which take nutrients and oxygen to the hepatocytes. And then there are small tubes inside the liver which take the bile produced in the liver to the small intestine. So these tubes, as they come down towards the intestine, join to form a larger tube. So for the purposes of treatment and to decide on the location of the disease, the liver has been divided into 8 parts. These are called segments. As you can see in the picture, these parts are divided from 1 to 8. And the liver is one of the few organs in the body which has a double blood supply. So the blood vessel which you are seeing in red, it is coming from the heart. It is the hepatic artery. It carries majority of the oxygen requirement of the liver. And the blood vessel just behind it, the dark blue blood vessel, is a much bigger vessel, and it carries the nutrients from the intestines to the liver. So both the blood supply is important for the functioning of the liver. And this green tube is the bile duct. It is all the internal smaller tubes joined to form the bigger tube. This takes the bile to the intestine, pitta coli, and this is the gallbladder, pitta pipe. So cancer is nothing but a disease where the body cells start to grow in an uncontrolled and a purposeless fashion. So due to some reason, some mutation occurs inside the cancer cells, and these cells, they give up the usual architecture and keep growing as a mass without any purpose. And once they keep growing, they go deeper, and then beyond the organ, they just start spreading everywhere, and that's how they kill the individual. So the cancer stages are basically divided into 4 stages. Stage 1, 2, 3, and 4. As you can see in this picture, stage 1 is just a superficial cancer. Stage 2 invades the submucosa. Stage 3 invades the whole organ, and the stage 4 is it spreads to the nearby organs, and it spreads outside to other organs. So stage 4 is the last stage of cancer. ஒரு இடத்திலிருந்து இன்னொரு இடத்துக்கு பரவக்கூடிய புற்றுநோய், அது புற்றுநோய் பரவிடுச்சுன்னா அது ஸ்டேஜ் 4. அந்த உறுப்பிலேயே இருந்ததுன்னா அது ஸ்டேஜ் 1, 2 or 3. ஸோ இந்த ஸ்டேஜ் 1, ஸ்டேஜ் 2 இதெல்லாம் ஏர்லி கேன்சர் அப்படின்னு சொல்றது. இதுல குணப்படுத்தக்கூடிய சான்சஸ் அதிகம். ஸ்டேஜ் 3 ஸ்டேஜ் இது கொஞ்சம் அட்வான்ஸ்ட் கேன்சர். ஸ்டேஜ் 4 வந்து உடல் பூரா பரவிய கேன்சர். இதுல குணப்படுத்தக்கூடிய சான்ஸ் ரொம்ப கம்மி. ஸோ த லிவர் கேன்சர் டைப்ஸ் ஆர் 2 types, பிரைமரி அண்ட் செகண்டரி. ஸோ பிரைமரி லிவர் கேன்சர் நம்ம இப்பதான் பார்த்தோம். இந்த லிவருக்குள்ள 3 விதமான செல்ஸ் இருக்கு. ஹெப்படோசைட்ஸ், பைல் டக்ட் செல்ஸ் அண்ட் பிளட் வெசல்ஸ். ஸோ இந்த all these 3 types of cells can produce cancer. So the most common type of cells is hepatocytes. So the most common type of cancer is also hepatocellular carcinoma, which contributes to 75%. Then the second most common is the bile ductal cells, which give rise to intrahepatic cholangiocarcinoma in up to 10 to 20% of cases. And a rare form of cancer is angiosarcoma, arising from the blood vessels inside the liver. So these are cancers which originate inside the liver. Then there is secondary liver cancer. Secondary liver cancer is much more common than primary liver cancer, and it is the commonest type of cancer which we see in day-to-day clinical practice. Secondary liver cancer is any organ of the body where the cancer starts and it spreads through blood vessels to the liver, because liver has double blood supply and it has a very rich blood flow. So liver is one of the organs where cancer easily spreads. So the primary organ from where the cancer spread can be from the stomach or intestine or breast, ovary, pancreas, or any organ in the body. So hence this type of cancer, all secondary liver cancers are considered stage 4 cancers because they are spread from some other organ, and cure is not possible in this type of cancers. We will primarily talk about primary liver cancer and liver health and how to maintain a healthy lifestyle. So what is needed for a healthy liver? So it depends on diet, then your physical activity. What should we eat in the diet? As you can see in this picture, all the colorful things are needed for balanced diet. What are the colorful things? They are fruits, green vegetables, diet rich in protein. Natural fats are good for the liver health. These are avocado, olive oil, nuts. Then whole grains are good than processed grains. Whole grains include brown rice, whole wheat bread, millets, etc. Whereas processed grains include white rice, maida, these type of things. Then a lot of water is good for health overall, and it also is needed for maintaining a healthy liver by giving a good blood flow to the liver and helps in easily detoxifying liver, carrying out its detoxifying functions. And regular physical activity like walking, jogging, or running for at least 30 minutes a day is very essential for liver health. ஆரோக்கியமான உணவு மற்றும் ரெகுலரா டெய்லி வந்து நம்ம ஒரு அரை மணி நேரமாவது வாக்கிங் பண்ண லிவர் ஆரோக்கியம் ரொம்ப நல்லா இருக்கும். ஸோ எதெல்லாம் நம்ம அவாய்ட் பண்ணணும்? ஸோ we have to avoid the things in the diet. It is very difficult to avoid, but these are the things which are so easily available that all of us love eating. So we should avoid a lot of sweets. 1 or 2 sweets are okay, but we should avoid a lot of sweets. We should avoid fried foods. We should avoid junk foods. As you see in the second picture, these are the junk foods. These are all fit for only dustbin. They are not fit for our stomach. So burger, French fries, pizza. So these type of foods are totally unhealthy for the body as well as for the liver. Alcohol in a social drinking is acceptable, but alcohol addiction or very heavy alcohol consumption is injurious to the liver. And we should avoid a sedentary lifestyle. We should maintain an active, healthy lifestyle. And we should keep a check on our weight. We should not become overweight. Overweight causes fat deposition in the liver and leads to poor liver health. So what are the risk factors for primary liver cancer? So chronic infection with hepatitis B or hepatitis C is the most important risk factor and most commonest cause of liver cancer today worldwide. The second most commonest cause is cirrhosis due to any cause. Cirrhosis என்றால் கல்லீரல் சுருக்கம். கல்லீரல் சுருக்கம் ஆல்கஹால்னாலையும் வரலாம், இல்லை இந்த ஹெப்படைட்டிஸ் வைரஸ்னாலையும் வரலாம், இல்லை பிறப்பால் இருக்கிற சில ஜெனட்டிக் டிசார்டர்ஸ்னாலையும் கல்லீரல் சுருக்கம் வரலாம். எந்த காரணத்தினால கல்லீரல் சுருக்கம் வந்தாலுமே அந்த சுருங்கிய கல்லீரல்ல கல்லீரல் புற்றுநோய் வரத்துக்கு ரொம்ப சான்ஸ் அதிகம். 10 மடங்குலேருந்து 15 மடங்கு அதிகம் ஜெனரல் பப்ளிக் கம்பேர் பண்ணும்போது. Then the third risk factor is diabetes. Fourth risk factor is NAFLD, also called fatty liver disease, and obesity. We just saw how bad obesity is for the liver health. Then excessive alcohol consumption is bad for liver, and environmental factors, aflatoxin exposure in contaminated grains, especially badly stored peanuts, and the thorotrost exposure in industries. So these are risk factors for primary liver cancer. So as you can see, the left side is a healthy liver. It is a reddish pink in color, and it is having a smooth surface. Whereas the right side, you can see the picture of a cirrhotic liver. கல்லீரல் சுருக்கம் வந்து கல்லீரல் இப்படிதான் இருக்கும். Surface is nodular and the color is different. So இந்த கல்லீரல் உள்ள திரும்ப வந்து ப்ராப்ளம் வந்து அந்த ஆறின தழும்பு தான் நிறைய இருக்கே தவிர இதுக்குள்ள நார்மலா வந்து வேலை செய்யக்கூடிய ஹெப்படோசைட்ஸ் ரொம்ப கம்மியா இருக்கும். Whereas இதுல தழும்பே இல்லை, ஃபுல்லா ஹெப்படோசைட்ஸ் இருக்கு. So this liver is a healthy liver. This is a it's a non-functioning or a poorly functioning liver. So then we can see the comparison between healthy liver and fatty liver. This is the healthy liver on the left side, whereas on the right side you can see the fat deposition. This happens due to overweight. நமக்கு சக்கரை நோய் இருந்தாலோ இல்லை அடிக்கடி இந்த ஜங்க் ஃபுட்ஸ் பீஸா பர்கர் இப்படி சாப்பிட்டாலோ அந்த எக்ஸ்ட்ரா கொழுப்பு வந்து நம்ம கல்லீரல்ல போய் படிஞ்சு கல்லீரல் கலரே மாறிடும். ஸோ கல்லீரல் போற பிளட் சப்ளை, ஆக்சிஜன் எல்லாத்தோட பெனிஃபிட்டும் இந்த கொழுப்புகள் எடுத்துக்கும். நார்மல் கல்லீரல் செல்ஸுக்கு வேலை செய்யறதுக்கு அடிக்குவேட் நியூட்ரிஷன் பத்தாது. ஸோ திஸ் லீட்ஸ் டு கேன்சர் as well as in the long term, over 15 to 20 years, liver cirrhosis. So how can we prevent liver cancer? So there are some measures which we can do. So hepatitis B vaccination is one of the important measures to prevent chronic hepatitis B infection. And in India, luckily it has been made as a universal immunization at present. And it is given to all children at childhood for 3 doses. In hepatitis C virus, luckily we have developed drugs called direct antiviral drugs, direct acting antiviral drugs, which can completely cure the hepatitis C right now. But at present, there is no vaccine which is available. So then a healthy, balanced diet and a physical activity can avoid obesity and fatty liver. With these two are risk factors for liver cancer. Then we need to avoid regular and heavy alcohol consumption to prevent damage to the liver. So how do we find out that we have liver cancer or not? So liver cancer should be diagnosed at an early stage so that we can effectively treat it and avoid death from liver cancer. So this early stage diagnosis can only be achieved by screening. Screening in high risk individuals like people with chronic hepatitis B infection or C infection, or people who regularly consume alcohol, or people who are known cirrhotic. So these people should have regular hospital checkup, and in the screening of blood using tumor markers like alpha fetoprotein or screening scans like ultrasound scan of the abdomen, we can find out whether there is a liver cancer or not. For patients who have proven cirrhosis, there is a protocol developed where they have to do blood test every 3 months and ultrasound scan every 6 months. This is the mandatory to avoid missing a liver cancer at an early stage. So symptoms of liver cancer. இப்போ கல்லீரல் புற்றுநோய்க்கு என்ன அறிகுறி, எனக்கு கல்லீரல் புற்றுநோய் இருக்கான்னு எனக்கு எப்படி தெரியும்? ஸோ ஏர்லி ஸ்டேஜ் லிவர் கேன்சர், அந்த ஸ்டேஜ் 1, 2, அந்த ஏர்லி ஸ்டேஜ்ல வந்து there will be no symptoms. So screening is the only way to find out early liver cancer. So யாரெல்லாம் வந்து கல்லீரல் ஹெல்த்துக்கு பாதகமான திங்ஸ் பண்றாங்களோ அவங்க எல்லாம் வந்து they should be aware and they should get regularly screened for liver cancer. People who are healthy, they don't need to be screened. Then advanced liver cancer. Advanced liver cancer வந்தால் என்னென்ன அறிகுறி இருக்கும்? There will be pain in the upper abdomen near the right side. There will be unexplained weight loss, இடை குறைவு. There will be lack of interest in food. சாப்பிட மனம் இல்லாமல் போகிறது. Feeling of lump in the right upper abdomen. வயிற்றுல கட்டி மாதிரி ஃபீல் ஆகிறது. Then எக்ஸசிவ் டயர்ட்னஸ், வீக்னஸ், ரொம்ப அட்வான்ஸ் ஸ்டேஜஸ்ல ஜாண்டிஸ், மஞ்சக்காமாலை வரலாம், வயர் வீக்கம், வயர்ல நீர் கோக்கலாம், அசைட்டிஸ், அண்ட் ரத்த வாந்தி வரலாம், blood vomiting. So these are the symptoms of liver cancer. How do we diagnose and how do we stage liver cancer before we treat the liver cancer? So first, the aims of diagnosis to first confirm liver cancer. Then we have to find out the type of the liver cancer. Then assess the size and extent of spread within the liver and outside the liver. And then whether the liver is normal or cirrhotic. So these are the parameters we need to assess before we can decide on a treatment plan for any case of liver cancer. So we need to do blood tests. For example, we need to do liver function tests, prothrombin time, platelet, alpha fetoprotein. Then we need to do imaging studies. Most common is a contrast CT scan of the abdomen and PET CT scan of the abdomen. And if there is a doubt in CT scan, then MRI of the liver. And whether this liver is a cirrhotic, if the CT scan and the blood tests do not show clearly that the liver is cirrhotic or not, there is a doubt. The borderline case, we can do fibroscan to check whether the liver is fibrotic or having early cirrhotic changes. And upper G endoscopy also can be done to screen for varices. And if the doubt is still persisting, then we can do a liver biopsy using a ultrasound guided needle to check whether the liver is cirrhotic. This should be done before we start the treatment. So CT scan picture, you can see the comparison. The left picture is a normal structure of the liver in CT scan, whereas in the right side, you can see the liver tumor. This is the hepatocellular carcinoma, the arterial phase showing enhancement of the liver. Then this is a PET scan picture of liver tumor. The left side, you can see the tumor is there. This is the normal liver. இதுல ரத்த குழாயெல்லாம் நார்மல் பிரான்ச்சிங்ல ஓடிட்டு இருக்கு. இந்த இடத்துல ரத்த குழாய் எதுவும் இல்லை, கட்டி மட்டும்தான் இருக்கு. ஸோ அந்த கட்டி இருக்கிற இடத்துல மட்டும் there is excess uptake of this FDG. So this shows up as a bright light. So கல்லீரல் புற்றுநோய் ப்ரூவ் பண்றதுக்கு பயாப்சி தேவையா? கல்லீரல் புற்றுநோய் ப்ரூவ் பண்றதுக்கு பயாப்சி தேவையில்லை. சிடி ஸ்கேன், எம்ஆர்ஐ ஸ்கேன் அண்ட் பிளட் டெஸ்டே போதும். இதெல்லாம் செஞ்சதுக்கு அப்புறம் என்ன டைப் ஆஃப் புற்றுநோய்னு டவுட் இருந்தால் மட்டும் நீடில் பயாப்சி பண்ணா போதும். அதர்வைஸ் நீடில் பயாப்சி தேவையில்லை. ஸோ ஸ்டேஜிங் சிஸ்டம். The commonest staging system used currently for treatment of liver diseases, liver cancer, is Barcelona Clinic for Liver Cancer, BCLC staging system. Based on this, the hepatocellular carcinoma is divided into 5 stages: very early, intermediate, advanced, and metastatic. So usually cancers are staged in 4 stages. The change here is a very early stage, which is a very small tumor, detected only on routine screening. So we need to decide the treatment based on these stages. Only in the very early stages, the liver cancer is curable, and we have to do a surgery with radical intent and cancer-free clear margins. So about 30 to 40% of liver is adequate for a normal function. So we can remove the 60 to 70% of the liver during surgery to treat the cancer. And within 2 to 3 months, this liver will grow up to 90% of the size and volume, and it will take over the function of the whole body. So if the liver cancer is diagnosed at a very early stage, then there are high chances of cure and low rate of complications if the liver cancer is treated by a dedicated multidisciplinary team with a hepatopancreatobiliary or a liver transplant surgeon in the team. So இதுல நீங்க பார்க்கலாம், இதுல வலது பக்கம் கட்டி இருந்தது, அதுக்காக வலது பக்கம் அந்த வலது பாதி லிவர் எடுத்தாச்சு. ஸோ இடது பாதி மட்டும்தான் இருக்கு. இது 30% தான் இருக்கு. இந்த 30% நீங்க பாத்தீங்கன்னா 2-3 மாசத்துக்குள்ள இவ்வளவு பெருசா வளர்ந்துருச்சு. இது சைஸ் உங்களுக்கு ஷேப் வந்து லிவர் மாதிரி இருக்காது, பட் இதோட வால்யூம் பல்க் பாத்தீங்கன்னா இது வந்து ரெகுலர் லிவரோட வால்யூமோட 90% கிட்ட வந்திருக்கும். So this is how the liver has regenerated to the bulk of the regular liver. Up to 90% it will reach the original bulk. So earlier we were doing open liver surgery where major liver resection was only done and there was no energy device, proper energy device. So there were a lot of blood loss and a lot of surgical complications with high death due to liver surgery. So liver surgery used to be a scary thing, but with the newer understanding of the segmental division of liver and the newer energy devices with screening, detecting smaller earlier liver tumors, we can remove even the individual segments with the bloodless dissection using the energy devices, and this can lead to an uneven full recovery with no complications. So in today's era, most of the HPP centers do liver resection, routine planned elective liver resection without blood transfusion. So this is an example of a open surgery where open liver resection is being planned. So what about laparoscopy and robotic surgery in liver surgery? So laparoscopic and robotic surgery has increasingly been developed in the last 10 to 15 years. It is being used for liver surgery, and it is fastly becoming a standard of care, especially in Eastern countries like Korea, Japan, and China. So the advantages of laparoscopic and robotic surgery are, during surgery, a very good magnified view is there to meticulously do surgery using energy devices with less blood loss. And வயருக்குள்ள நம்ம பண்ற சர்ஜரி சேம் தான், பட் லாப்ரோஸ்கோபிக் ரொபோட்டிக்ல என்ன அட்வான்டேஜ்னா நம்ம வயரை கிழிச்சு பண்ண மாட்டோம். சின்ன சின்னதா வந்து நிறைய இடத்துல ஹோல்ஸ் போட்டு பண்றதுனால தழும்பு வராது, தழும்பு இல்லாதனால வலி இருக்காது, வலி இல்லாம தழும்பு இல்லாம இருக்கிறதுனால காஸ்மெட்டிக் லுக் பெட்டரா இருக்கும், அண்ட் ரொட்டீன் ஒர்க் வந்து திரும்ப வேலையை ஜாயின் பண்றது சீக்கிரமா வந்து ஜாயின் பண்ணுவாங்க. ஓப்பன் சர்ஜரி பண்ணா அட்லீஸ்ட் வந்து 2 to 3 weeks வந்து பெயின் இருக்கும், அவங்களால எல்லா வேலையும் வந்து சகஜமா பண்ண முடியாது. லாப்ரோஸ்கோபிக் லிவர் சர்ஜரியில வித்தின் a week they can join back work after discharge. And long term risk of hernia, incisional hernia through the surgical incision is negligible in laparoscopic and robotic surgery. So these are some photos of laparoscopic and laparoscopic liver resection being done for hepatocellular carcinoma at our center. So this we are using a laparoscopic ultrasound probe to just check the FLR for any occult lesions, and here we are starting the transaction using harmonic and bipolar. So you can compare the scar of laparoscopic and open surgery. Open surgery, there is a big scar, whereas in laparoscopic surgery there are multiple small scars, and most of these scars become untraceable by 6 months to 1 year after surgery. So how to treat liver cancer and cirrhosis? So whatever we saw till now, surgery that is easily plannable and doable in early liver cancer in non-cirrhotic liver, whereas if it is in cirrhosis, it is a tricky part. We need to see whether the patient will tolerate resection. We have to assess the liver function. Most of the time the patients are malnourished and they are very weak, and if the liver function is bad, then they don't tolerate a liver resection surgery. The cirrhotic liver does not grow well after surgery, and there is high chance of liver failure and death. So practically if there is a liver cancer and liver cirrhosis, most of the centers offer liver transplantation as a treatment of liver cancer. So this is you can see that there is a cirrhotic with tumor, and here we have transplanted a new liver. This is a cadaveric liver. மூளைச்சாவு அடைந்தவரோட உறுப்பு தானத்தினால கிடைச்ச புது லிவரை நம்ம டிரான்ஸ்பிளான்ட் பண்ணியிருக்கோம். பண்ணா இப்படிதான் இருக்கும். ஸோ இதுல அட்வான்டேஜ் என்னன்னா வந்து எந்த இடத்துல வந்து கேன்சர் வந்திருக்கோ அதுவும் வெளியில வந்துடும், மீதி லிவரும் வந்து சுருங்கின லிவர், அதுல ஃபியூச்சர்ல கேன்சர் திரும்ப வர்றதுக்கு சான்ஸ் இருக்கு. ஸோ அந்த ரிஸ்க்கும் நம்ம எடுத்துடும், அண்ட் பேஷண்ட் கெட்ஸ் அ நியூ லிவர். So what are the options for advanced liver cancer? So advanced liver cancer நம்ம வந்து பேஷண்ட்டை ஃபுல்லாக குணப்படுத்த முடியாது. ஸோ நம்மளோட ஆப்ஷன்ஸ் வந்து அவங்கள இருக்கிற வரைக்கும் எவ்வளோ கம்ஃபர்டபுளாக வைக்க முடியுமோ we have to keep them and we should keep them symptom free. So whatever symptoms they have, if they have pain, we have to make them pain free. If they have jaundice, we have to try to treat the jaundice. If they have itching, we have to treat the itching. If they are having weight loss, we have to look for options to maintain the nutrition. So these are the options or the goals in treatment of advanced liver cancer. This is called best supportive care. And to aid in this best supportive care, there are we can control the growth of the liver cancer using radiofrequency ablation or microwave ablation or SBRT radiotherapy or targeted selective embolization of the blood vessels going to the liver tumor, TACE or TAR, and targeted molecular therapies like sorafenib. So if we are able to do TACE or TAR, then the survival is much better than other modalities. So if the liver cancer is spread outside the liver, then it is best to give only supportive care and not opt for the other options given above. So in conclusion, a healthy diet, regular exercise, and avoid alcohol and routine hepatitis B vaccination is mandatory for liver health. Liver cancer can be diagnosed at an early stage by only screening. So people who have the risk factors, people who regularly take an unhealthy diet, people who do not do exercise, people who regularly consume alcohol, they have hepatitis B or hepatitis C infection, or they have liver cirrhosis, should be aware, and they should undergo regular screening of the liver by hospital visit. The type and extent of the tumor can be assessed easily by imaging scans. There is rarely need for a biopsy. Early liver cancer can be successfully cured by radical surgery with minimal complications. This radical surgery is at present possible with laparoscopy or robotic surgery. It is now proven to be safe with the advantage of early recovery, less pain, and smaller cosmetic scar. And early liver cancer and cirrhosis is usually treated by liver transplantation. உங்கள் கவனத்துக்கும் நேரத்துக்கும் மிக்க நன்றி. Thank you.
Questions anyone has?
Leave.
Somebody. There are questions in the postpones. Liver surgery in corona time. Cancer also. What is சொல்லிட்டு க்ளோஸ் பண்ணிக்கலாம்.
இந்த கொரோனா டைம்ல we can do a safe liver surgery by following all the precautions, by screening the patient as well as the patient relative for COVID symptoms at the entrance, as well as by taking a COVID swab, and by doing HRCT screening, we can make sure that they are COVID negative before surgery. And if we make sure this, then liver surgery is possible the same as before COVID, and we can get the same results as before COVID. We are doing all types of liver surgeries at GEM, including laparoscopic and robotic surgery. And during this COVID time also, we have done more than 25 to 30 major liver resections in the last 6 to 8 months. Thank you.